Northeast region correspondent bringing us up to speed on a disinfection exercise which is underway there. Now, information on how people can avoid catching COVID-19 highlight the need for regular hand washing with soap and running water and the practice of social distancing. Now, that shouldn't be too difficult for many people who have fairly decent accommodation and access to utilities. Same, however, cannot be said of those living in some of Ghana's most densely populated communities where living conditions do not permit. My colleague Justice Bedu has spent time at Old Fadama to find out what a coronavirus pandemic means for the country's most vulnerable.
In the
room where people used to come for health care, hands are now raised in prayer, hoping that could save a community of over 100,000 people from the venom of a global pandemic that has now infected nearly 1 million people and killed over 35,000.
Once upon a time, this was the only health facility providing health care for the thousands of people who live here in Old Fadama. This was run by a private citizen. Once the man who led this facility died, health care in Old Fadama died too. And in its place is this rundown infrastructure taken over by filth and also churches.
This is Ghana's biggest shanty town, a mixed bag enclave bustling with life. Old Fadama is badly overcrowded, and coronavirus, if it does strike here, will do damage. Everyone knows, but people must eat. That's why they all came here after all.
Here we are crowded, very crowded.
Here, social distancing is a rare privilege only a few can afford. There are no sanitizers and no running water, even if people wanted to wash their hands.
My leg was worrying me. I can't wear boots. They say I should take time that I shouldn't get any sore.
Israel Agbenu has already been diagnosed with diabetes, and with no hospital here, he travels outside the slum to see a doctor every week.
This coronavirus, we don't know what it is. But you know here, most of us, we are illiterate. If somebody's sick, unless you have to go to Kolebu, before you get taxi, but you know taxi, some of them, they don't want to come in. If you beg them, they will not come in. And that time, maybe something can happen. So at times, we put the person at the back, up to the roadside, to take money, drop into some place to some place. If I don't have that money, I'll make quiet and die.
But not everywhere in Ghana looks like Old Fadama.
Medifem Hospital, good morning, I'm speaking.
This is the Medifem Multi-Specialist Fertility Center, one of the few upmarket private hospitals in Accra. Located in one of its affluent neighborhoods, quality health care is available if you have the money to pay. And here, they seem very ready for COVID-19.
There's this difference between the poor and those who can afford, or the poorly resourced and those who can afford it. And the poorly resourced, even to get access to the public hospital, it's not easy. You have to get into some 4 means of transport to get to the public facility. When you get there, you've got to queue for a very long time, which engenders the spread of the infection.
Deeper inequities in our health system are going to be very exposed in this COVID-19 period and post-COVID-19. We've made the system run as it has, with fewer or less numbers of people enrolled on the National Health Insurance Scheme, which would have provided financial access to people. We haven't provided over time sufficient infrastructure to support a situation like the COVID-19.
Every tribe is here, is in this community. You see, so if you are there as a millionaire, you are there, and then they are building the facility for them. Anything happen to this community, it will go affect all of them. Because we have the Kayaye, if the people, they come down from the Medina, or even president, they do market here. You see, and they use the Kayayo, carry my pan for me. And so if one is affected, you carry it to your own place as well.
COVID-19 is spreading like wildfire, and experts warn it's only a matter of when and not if that it would arrive here in Old Fadama. Everyone here knows that. What they do not know is if they, like Ghana's privileged few, would ever be ready for it. Justice Bedu, JoyNews, Old Fadama.
And here in the studio, my name is Ernest. Many thanks for your company here on News Text. There's more news when you log on to myjoyonline.com. Up next is JoyNews Interactive. Stay tuned in.